in our office, so we are grateful to have him with us this evening. Because Americans for Prosperity called this meeting today, I'd like to give them the opportunity to spend about an hour sharing with us the concerns that they have. We would have loved to have had the meeting in our office, but as many of you are aware, our conference room holds about 6 people comfortably and maybe a dozen if we all squeeze in there. So we are happy that we are able to have as many of you here tonight as we do. After about 8:15, we would like to open up the meeting so that anyone that has a concern either for or against health care would be able to share their concern with the group. But I'd really like to give the folks that are here opposed to health care an opportunity to be heard, and I would ask...
Not opposed to health care.
Not opposed to health care reform, have some concerns with health care reform. Thank you for that.
It's all about power.
And I'll start first by sharing Senator McCaskill's positions, and I think that if when we get started, take turns coming up here to the microphone and listening to what folks have to say, we might all be able to learn from one another about what the concerns are and be able to share those with Senator McCaskill, who will be in our area on August 11th holding kitchen table talks, and at that time you'll have an opportunity to hear from her directly. But so I'll start with is Senator McCaskill's position. She believes that the healthcare system is in dire need of reform, and that there are still many tough issues to resolve in the healthcare debate, including insurance coverage mandates, whether a public program will compete with private insurers, and how to pay for it. Our priorities, along with the healthcare industry leaders, are that patients have choice of care. If you're happy with your current plan, you should be able to keep it, and you will be able to curb skyrocketing costs with better outcomes, and expand coverage for the uninsured. I know that many of you have concerns about a public option. Senator McCaskill does support a public option. She thinks it will enhance competition. The healthcare reform needs to provide for better transparency and accountability. We have to bring healthcare costs down. Senator McCaskill will not support any healthcare plan that is not paid for. If it adds to the deficit, she will not support it. No small feat for Congress. Senator McCaskill looks forward to working with her colleagues in a bipartisan fashion to find a fiscally responsible solution for the health of Americans. Our country can afford health care on the trajectory it is currently on. Costs must be brought under control for the long-term fiscal health of our country. I am here today to listen, to take your concerns back to the Senator, and I look forward to hearing from you this evening. At this time, I'm going to go ahead and turn it over to Carl. I will tell you up front, I may not have answers to all of your questions. I have shared with you Senator McCaskill's concerns, but I will take your questions back to her, your concerns and your comments, because it's important that we listen and hear what you have to say. I'm going to go ahead and turn it over to Carl, and we'll get started with his questions and opening statement. Thank you.
Thank you, Michelle, and I welcome to all of you for turning out and for making us move. And upstairs, whether you're for or against the reforms being proposed, the fact that you are here and exercising your rights and your abilities to have your voices heard is what we want to accomplish tonight. So thank you all for making that effort. There are a number of signs in the audience. Some people made a lot of effort to make the signs. Others brought signs. Everyone who has a sign, hold them up. Everybody look around. All right. Put the signs down and please leave them down for the rest of the night. Now, that is not to discourage you from expressing your views, but let's do it in a vigorous and courteous way. And then hold the signs up while you want to as you're leaving, as you're going, and you're honking, and do all those things that you want to do, and have your voices heard in that regard. But please, let other people who may be behind you or around you, don't block their view. Let them see what's going on. Now, as Michelle mentioned, she's here for Senator McCaskill, who, as you may know, they're still in session until the end of July, somewhere about there, until the August recess. So there is no congressman or senator in the state that I'm aware of right now. But Michelle is here to, as a former elected official, but anyway, Michelle is here to take your comments, and as she outlined it, the first hour is dedicated to those folks who want to talk about why you are opposed, or why you're against, or what problems you have with the proposed government takeover of our health care. So, we want you to line up. Line up. Prepare look, we have very adamant and passionate views in this room tonight on both sides of this issue. And we need to respect those views. You don't have to agree. And I'm not saying you have to agree with someone who says something that you don't agree with, but you should respect the fact that they're going to say it, and you may not agree with it. And then at 8:15, the folks who are going to hold a contradictory view to what many of you hold are going to speak in the same courtesy to them as well. So we appreciate Michelle coming out. Senator McCaskill will have the opportunity, I think, to meet with folks as she's in the district. So again, if we'll start lining up, you'll ask questions. As Michelle said, she can tell you the senator's position on certain areas, and then she'll take your comments, and she has staff here who is reporting what you say, so that she can report that back to the senator. And that's the job. That's what we would have received that Friday at Senator McCaskill's office when what I referred to as the unfortunate event occurred. And so now we have the opportunity to do that. So we'll begin. If when you step to the mic, please talk directly into the mic. Tell us your name, state your comment or question, and please allow people to finish their statements. Allow Michelle to respond accordingly. Thank you all again for being out.